Well, welcome everybody to the July online program for the alumni of the Sunshine Coast Health Center up here in Powell River, British Columbia. And this month, our theme is going to be drug prevention. Yeah, I know it sounds kind of weird. Mainly because it obviously didn't work for you and me. But I think if we understand some of the research going on with the drug prevention programs, what works, what doesn't work, we'll get some insight into what the addiction is and a few clues maybe on how to overcome it. Okay, so the first thing to do is give you some statistics. So these numbers come from the Department of Health, that's the federal department from the Government of Canada, published in the year 2007. Okay. So a little survey they gave to Canadian youth age 15 to 24, okay? So here's what they discovered. Okay, this is for illegal drugs, okay? It says 39.7% said they had never used an illegal drug. 38% said they had used only pot, okay? And 23.7% said they had used an illegal drug other than pot. Now for booze, just about 100% used alcohol at some point in their lives. Then within the last year, 82.9% said they'd used alcohol. Now of that 82.9% of that group that used alcohol in the past year, well, you can guess how many got drunk weekly. Well, if you were here under the new program, you know the number is probably around 10%. And in fact, turns out to be 13.8% for this particular survey. But here's the interesting one. People who got drunk monthly, 40.6%. Like that's a pretty big number. All right, those are the numbers that have come out from the federal government. And of course, you can imagine what the parents are thinking and community groups, teachers. I mean, those are pretty high numbers. So what they've done is they've created these drug prevention programs, or they borrowed them from ones made in the United States. Okay. And there's this theme that's behind all drug prevention programs, and the theme basically is drugs are bad. Okay. They used to have these celebrities come in to schools and talk about it, like famous people who have now gotten over drugs. I don't know if Drew Barrymore ever did this, but she'd be typical of someone who would go into a school or a big community setting and talk about their experience on drugs as a warning to the young people, don't do what I did because look at how it screwed up my life. Unfortunately, the whole thing backfired because what the young people were thinking is, wow, hey, I could do tons of drugs, get as famous as this person, and then clean up later and still make millions of dollars. Go figure. They don't invite celebrities to give their stories anymore. But they do a lot of, in Surrey a few years back when I used to live there, they used to have these big, huge town hall meetings, like 3,000 people, 2,000 people, and they would invite in people who were in recovery to tell their stories, right? And they would, and again, these are stories of suffering and misery, and the idea was, well, don't do what I did, because I thought it was a good idea at the time, but it didn't work out. But just about all programs that deal with drug prevention are designed like this, right? Perhaps the most famous one in Canada and the United States at least is DARE, and I'm sure you've heard of this. So it was originally developed out of California by a guy by the name of Rolnick, and with the help of the local police there. Anyway, it's a fascinating program because what we discovered, although it sounds like it should work, right? Yeah. Unfortunately, it didn't work that good. Even the Department of Health in Canada figured out by the year 2001, it really wasn't working that good. But other groups, such as this outfit known as the General Accounting Office in the United States, which is like the government watchdog on how tax money is spent, they got involved studying DARE because the American government gives about $1 billion or so to the DARE program, and that doesn't pay for it, by the way, that's just a contribution. But if you get $1 million tax dollars, the government wants to make sure they're well spent, so they do these big studies on them. Anyway, the study done through the General Accounting Office discovered that, DARE doesn't seem to work that good. And we keep finding this. There are, now for the programs that are scientifically based, according to the Government of Canada and the United States government, there's, I don't know, a couple of dozen, maybe 3 dozen that seem to have some basis in research, which they publicize and say these are all very good. And every one of those programs is based on this concept that drugs are bad, so don't do drugs. Okay? Interestingly enough, when the hotshot scholars looked at the scientific evidence for these programs, they weren't all that impressed. In fact, there's a bunch of them would, well, one fellow, a guy by the name of Holder, he actually cataloged a list of all the deficiencies in the research. So we've got all these people presenting these programs who say, oh, this is all very scientific and based on fact, and yet the hotshot researchers come in and actually look at the evidence and say, no, this stuff isn't good. They actually, well, not to put too fine a point on it, they basically cheated. They didn't follow the rules of the game. So they would publicize, for example, only results that were positive, that said that this program worked, and neglected all the results that said it didn't work. Yeah, things like that, which you're really not supposed to do. So they went methodically through a lot of these programs. Some of the biggest ones in Canada and the United States, something called Project Alert, or Life Skills Training, or Strengthening Families. These are all prevention programs that are approved by the Government of Canada and the Government of the United States, and yet these hotshot researchers go in and say, no, this stuff doesn't work at all. Look, we've gone through their numbers, and they don't make sense. In fact, in our experience working through this, that this prevention program does not work. So that's kind of interesting, eh? Anyway, so maybe a lesson, take-home lesson for this little video is that if you tell people that drugs are bad, don't do them, your chance of success is extremely small. Right? At any rate, next week we'll have a little deeper look into what may not be working with these programs. But, because it's one of those interesting things, right? It looks so good on paper, it should have worked. But unfortunately it didn't. So maybe next week we'll find some clues into why it didn't work. Anyway, see you then.